we talked about the circulation and blood system and disorders of those. We know the other part of the circulation system is the lymphatic system. So it works really in concert with the circulation of the blood. The lymphatic system returns a lot of the fluid that was released into the interstitial space. It's actually the start of the lymphatic system is in the interstitial space. And we'll just talk about the lymph system in general and then some lymph disorders. So the main lymph disorder that we can think of as lymphoma, which is a form of cancer. It's another one of the non-solid cancers. So leukemia is another one. So there's not like a tumor per se. It affects the cells of the lymphatic system and the cells of the blood system. So we're going to talk about the cellular presentation of lymphoma and how it's different from the cellular presentation of leukemia. We're going to compare Hodgkin's disease, which is lymphoma, and non-Hodgkins, including the pathology and the signs and treatment. And then we're going to talk about lymphedema and the etiology and treatment for lymphedema. You will have in your modalities class a certified lymphedema therapist come and talk to you and teach you some great techniques that you can use in the clinic, no matter what setting you work in. And it's particularly useful in outpatient. And usually lymphedema treatment is done outpatient, although even if you work in an inpatient setting, there is use for it, definitely. So the lymphatic system consists of lymphatic vessels, lymphoid tissue, lymphatic nodules, tonsils, lymph nodes, spleen, thymus gland, and red bone marrow. So when you think about all those components, you realize that the lymphatic system has a lot of play in immune function, right? Spleen, thymus, red bone marrow, all that stuff sounds familiar. The system's main function is to return excess interstitial fluid and protein to the blood. It's going to filter out and destroy unwanted materials from body fluids and initiate an immune response. So the lymph system is involved in all the stuff we've talked about so far, a lot of the stuff we've talked about. So the lymphatic vessels, so it's returning, the lymphatic vessels take up the fluid and they run it through the lymph system and return it to the cardiovascular system via the subclavian vein. And so that's part of the preload for the heart. Think about that next week when we're talking about cardiovascular. The lymph nodes are like little filters. They are little filters, and they filter and destroy foreign material. A lot of white blood cells, a lot of macrophages hang out in the lymph nodes. That's like the macrophage lounge. They're hanging out, just waiting to see what happens, what foreign material they find, and they're going to initiate their immune response from there. The lymph system also absorbs lipids from the GI tract, so that's pretty important. So it runs hand in hand and side by side with the circulatory system. So the lymphatic vessels originate as tiny little capillaries in those capillary beds. They're in contact with the capillary bed in tissues. So every place where we have that little capillary bed, we also have a system of lymphatic vessels. So the lymph is collected and by lymphatic trunks, and then the lymphatic trunks empty into ducts, and the ducts empty into the subclavian vein, and that goes back to the heart. So there's a great system of fluid return from the interstitial spaces. So proteins that accumulate in the interstitial fluids can only be returned to the blood system through the lymphatic vessels. So any condition that can affect normal return from lymphatic vessels could have a big effect on blood protein concentration and osmotic pressure. So we know how important osmotic pressure is in the inflammation process and healing. So The lymph system is intimately involved in all that. Basically, the lymph system and lymphoid tissue acts as defense, getting stuff out of the body before it gets into general circulation. So when infection is present, you get inflammation of those regional lymph nodes, and they're often swollen and tender. So you go to the doctor and they palpate your lymph nodes. They're seeing if your lymph nodes are swollen and tender. So anytime you have an immune response, the last COVID booster that I got, I had the flu and the COVID on the same day. I had the flu in one arm and the COVID in the other. And interestingly enough, they felt about the same. The COVID maybe was a teens more sore, but the lymph nodes under my arm on the COVID side actually swelled up a little bit more than they did on the flu side. So I thought that was kind of interesting. It was an interesting effect. The fluid that circulates in lymph is called, in the lymphatic system, is called lymph. So the lymph is a clear, watery, isotonic fluid. It resembles blood plasma, but it has a lower protein content. And that lower protein content is part of what drives the uptake of fluids. The fluid is, of course, then returned to the cardiovascular system via the lymph. So before we start to talk about lymphatic disorders a little bit, we'll talk a little bit about the lymphatic circulation. So it starts right here in the lymph capillaries, in the capillary beds. So unlike the blood system, which is continuously circulates and there's no end, you can't find the end of the circulation system. It circulates heart to arteries to capillaries to veins, back to the heart to arteries to capillaries to veins. It's a closed system. The lymphatic capillaries have blind ends. They terminate in the tissues around the capillary beds, and the interstitial, the excess interstitial fluid flows in as pressure builds up in the tissues. So it's different from the blood system in that respect. Just like in the blood system, the smaller vessels join to form larger vessels, and there are valves in the lymph vessels to assure one-way flow. So it always goes from the tissues to the subclavian vein. It's a one-way flow with lymph. So when we're doing manual lymphatic drainage, we're always going in that direction. We're going in the direction that we want the lymph to flow. Periodically, lymphatic vessels are interrupted by lymph nodes, and that's where the lymph is filtered, and more lymphocytes might enter the lymph via the lymph nodes. So remember I said that's the lymphocyte lounge, it's the macrophage lounge. They're hanging out in the lymph nodes. So if those lymphocytes need to get into the general circulation, they generally do it via the lymph. Pretty interesting, right? So the vessels of the upper right quadrant of the body empty into the right lymphatic duct. So upper right quadrant into the right lymphatic duct, and it returns the lymph to the general circulation via the right subclavian vein. The rest of the lymphatic vessels drain into the thoracic duct in the upper abdomen and the thoracic cavity, and that duct drains into the left subclavian vein. So it's a little bit asymmetrical. So certified lymphedema therapists, one of the things that they are good at, one of the things that they know a lot about is lymph anatomy and how to direct lymph around obstructions. So it's pretty interesting, actually. If it's an area of specialty that you can go into as a PTA, and it's something that you might find very interesting. So lymphatic capillaries in the intestinal villi also absorb and transport lipids. So they have some effect in our nutrition as well, in the absorption of lipids. So the lymph has its hand in everything, you know. There's a lot going on. So in terms of disorders, lymphomas, there are, again, like every chapter in this quarter, we're not going to talk about every disorder that is in the book. We're just going to talk about a few of them. But lymphomas are malignant neoplasms involving lymphocyte proliferation in lymph nodes. So the cellular presentation of a lymphoma is a proliferation of lymphocytes. Okay, so it's going to be T or B lymphocytes. The specific cause is not identified. There is a higher risk in adults who received radiation during childhood, for whatever reason. The two main disorders are Hodgkins and non-Hodgkins lymphoma. And they're distinguished by the number of lymph nodes that are involved. And with Hodgkin's lymphoma, a lot of times it's a single lymph node. Non-Hodgkin's is usually multiple lymph node involvement, and it's non-organized with widespread metastases. So Hodgkin's lymphoma initially involves a single lymph node. The cancer spreads to adjacent nodes to the organs via the lymphatics. So T lymphocytes are the defective cell in Hodgkin's lymphoma, and lymphocyte count is decreased. There is a cell that's called a Reed-Sternberg cell, and this is a micrograph of it. They're giant cells that are present in the lymph node, and they do a biopsy to find those cells. So they do a lymph node biopsy. So the presence of a Reed-Sternberg cell is the indicator that you have Hodgkin's lymphoma. So the symptoms, the first indicator is usually a painless enlarged lymph node. Painless. That's something to think about. So if you have an enlarged lymph node and it's not like you just got a vaccine or something, that might be something you bring up with your doctor. Later on, you get splenomegaly, enlarged spleen, and enlarged lymph nodes. And general signs of cancer, weight loss, anemia, low-grade fever, night sweats, and fatigue may develop. That's later on. It's treated by radiation if it's isolated in an individual lymph node. Most of the time, it's treated by chemotherapy. You might have a lymph nodectomy or a lymph node dissection in surgery. The staging and prognosis are dependent on the number of nodes involved and the location of the nodes involved. Non-Hodgkin's lymphoma, there is increasing incidence, and it's partially caused by HIV infection. So if you have had an HIV, if you've been infected by HIV, you have more of a chance of developing non-Hodgkin's lymphoma. It's similar in terms of clinical signs and symptoms to Hodgkin's lymphoma, but it's more difficult to treat because the tumors are not always well localized, like in an individual lymph node or a group of lymph nodes. The initial manifestation is an enlarged painless lymph node, just like with Hodgkin's lymphoma. With non-Hodgkin's lymphoma, though, it's usually multiple lymph nodes involved, and the Reed-Sternberg cell is not present. There is another neoplastic disease that involves increased production of plasma cells in bone marrow. So the multiple myeloma is mentioned in chapter 10 and chapter 11 because it involves the blood and the lymph system. It's not known what the cause is. It occurs in older adults. The production of plasma cells is increased, and it impairs the production of other blood cells. So we've seen that before in some of the anemias. There's such an increase in the production of one type of cell that the other cells are skimped. So you lose production of the other types of cells. And as we know, we need all of them, right? Or, they each have their role to play. With multiple myeloma, there are multiple tumors in bones, severe bone pain, which I guess is extremely difficult to treat, loss of bone, terrible prognosis with a very short life expectancy. So, yikes. The signs and symptoms of multiple myeloma, it's often an insidious onset, and the malignancy is well advanced before diagnosis. So we'll see some other types of cancer where this is the case. if the malignancy can get hold before you have any signs or symptoms with that insidious onset, it might be too late by the time you find out. Usually the first signs are pain caused by the bone involvement, anemia, and a tendency to bleed because we're skimping on red blood cells and we're skimping on thrombocytes because we're making the plasma cells. Impaired kidney function and eventually failure. The chemotherapy is used to encourage remission. The median survival for multiple myeloma is 3 years. So that's a terrible diagnosis. Lymphedema is the other main disorder that we're going to talk about having to do with lymph. And it's an obstruction of the lymphatic vessels by any number of things. The most common form of lymphedema is congenital. You just have an inadequate lymph system for some reason. Because there's obstruction of the lymphatic vessels, the extremities swell, you get accumulation of lymph. So you cannot cure lymphedema. You can treat it, though. Sometimes they'll use diuretics, bed rest, massage of the affected area, and we will be learning that in your modalities class. Manual lymphatic drainage is what it's called. And you can use that with not just lymphedema, but any type of edema situation. Edema after surgery, it works. So it's a great technique to learn, and you'll use it all the time in the clinic. Elevation of the affected extremity. Exercise is a great way to get lymph to flow. Yay. And compression. So there's different types of compression, and they can all be helpful for controlling the symptoms of lymphedema. So with lymphedema, it's so important that you manage it because you can't cure it. So it's one of those diseases that either you can manage it or you can't cure it. The sad part about lymphedema is that some people don't realize they have lymphedema. They think, well, I'm just fat. And it's not fat. It's accumulation of lymph. I worked with this lady. We have had, in the clinic where I work, where I've worked for the last 15 years, we always have a certified lymphedema therapist on staff. One of our PTAs is training in lymphedema therapy as well. So that is a service that we provide. So luckily I get to be in on the fringes of that. I have done compression wrapping with lymphedema patients. Even though it's not one of my specialties, I was just sort of trained on the job. It's the management of lymphedema can make the huge difference in someone's life. One of the things that I work with lymphedema patients on fairly frequently is aquatic therapy, because the lymphedema specialists work with them on the manual lymphatic drainage and the compression wrapping and everything. And then if they want them to do aquatic therapy, because the hydrostatic pressure helps with compression and you get exercise in the water. So sometimes they'll put them on my schedule for aquatic therapy. But I was working with one lady and she told me that she thought she was just fat, which I thought was really very sad. And she thought she would always just have to suffer with this. And like dieting didn't work, because obviously dieting's not going to work to fix that. Well, and she said one time she has just the greatest thanks for someone that she met in an airport. She was traveling, she was sitting in the airport, and I think she took her shoes off or something where her feet were out. And this person came up to her and said, I don't want to be pushy or bossy or anything like that, but I'm a doctor and I was wondering if you're getting treated for your lymphedema. And she just sort of said, what? That was the first time she'd ever heard that. And she said, I always just thought I was fat. And the person said, no, there's a completely different presentation between fat and lymphedema. And she said she cried, and she sat there in the airport crying with this doctor who changed her life, and she didn't even go to see the doctor, so she just thought I just thought that was a cool story. But she got treatment, she had significant relief, and she wasn't just fat. It was lymphedema. So we can change people's lives just teaching them how to manage their edema. So it's amazing. There are other causes. There's one of the biggest causes. The biggest cause of lymphedema in the US is cancer treatment. People get lymph nodes removed in the course of cancer treatment, and so they have an inefficient lymph system or a blocked lymphatic system, and so they get lymphedema in a single limb wherever their lymph node was removed. A lot of times with breast cancer, you get arm edema, arm lymphedema. The largest cause of lymphedema worldwide is a parasitic infection called filariasis is the infection, and the disease is called elephantiasis. It's actually lymphedema. You get significant swelling of the affected extremity, thickening of the subcutaneous tissue, frequent infections, skin ulcerations, and fever. And the treatment is medication to kill the parasite. And once you kill the parasite, the lymph system is freed up and the lymph drains and the limb goes back to normal. So we don't see that very much in the US, but worldwide, that's the biggest cause of lymphedema. In the US, cancer treatment is one of the biggest causes, or just congenital lymphatic insufficiency. So it's definitely so that will go away if that's the cause of lymphedema. It'll go away with medication treatment. Lymphedema from cancer treatment won't go away. Congenital lymphedema won't go away, and it needs to be managed.